Alright, so I'm going to talk about canine diabetes. I spent the summer in a clinic that focused on canine diabetes and what most clients were doing improper. So I'll tell you what it is and then the most mistakes that happen.
So now, was it a specialized vet clinic, or was it, let's say, a regular vet clinic, but they focused on diabetes?
It was a regular vet clinic. We had 3 doctors and one of them specialized in
Just did that.
diabetes.
So were other vets referring to the clinic then? You know what I mean?
Yes.
So you're getting more diabetic dogs than you normally would?
Yeah, we would get all the emergency cases.
Okay.
So diabetes affects 1 in 200 dogs. It's a lack of the hormone insulin, or it is inadequately used or response from the cells. And so in the picture, you can see a healthy pancreas is here, and it releases insulin, and it binds to the insulin receptor and allows the channel to open and glucose to enter the cell. In type 1, the pancreas doesn't produce any insulin or a very small amount, and so no insulin can bind to the receptor and the channel will open to allow glucose to travel in. In type 2, the pancreas develops insulin, but it can't bind to the receptor because it's incorrect production of insulin or incorrect receptor, and so the glucose channel won't open. Most common type that dogs have is type 1, and it occurs in mostly dogs that are middle-aged to older, and if a dog is a puppy, like a year or younger, it is automatically considered inherited. So the normal glucose levels is 75 to 100 milligrams per deciliter of blood. For a dog with low blood sugar or hypoglycemia, it's 60 or below, and a dog with high blood sugar or hyperglycemia is 180 and above. If you get below 60 or above 180, the dog can go into shock.
Okay, before you move on, I want to make sure everybody knows deciliter. What does that mean? Can you tell me in mils? You know what a liter is? A liter is 1,000 mils, right? What's a deciliter? If I wanted to replace this deciliter, that's 1 deciliter, but I wanted to replace it with milliliters. How many milliliters are in a deciliter? Anybody take it? 100. 100. So a deciliter, 1 deciliter equals 100 mils. Okay? So it's amazing how blood glucose is depicted this way. In my morning class, I was talking about how hormones are nanograms per mil of serum or something. I mean, it's amazing. I'm not sure the history of it, but it's 100 mils. So I mean, that's quite a bit of blood when you're comparing it to like a mil when you talk about hormones. So not sure why they do it that way, but.
So some of the symptoms are increased water intake, change in appetite and weight, increased urination, fatigue, nausea, blindness, and dehydration.
And before you, remember, we're partners. So what one word could she put up here instead of increased water intake? Polydipsia. So polydipsia, much drinking. And there's one word that replaces increased urination.
Polyuria.
Polyuria. Thank you, buddy. Okay.
So to diagnose it, a doctor will do blood work and urine analysis, and this measures the amount of glucose in the urine and blood, and if there's an excess amount of glucose, then they can draw conclusions based on that. For treatment, there's multiple treatments, but what we focus on, because it's so critical, is insulin injections and a high-fiber diet. So the diet is to keep the dog from being obese, because an increase in weight will cause a fluctuation, a bigger fluctuation in sugar. In serious cases, the dog can be hospitalized for a couple of days on IV and monitoring their blood glucose. A client that has a dog that's diabetic should monitor their glucose at least once a day. If the dog's untreated, then it has urinary tract problems, seizures, kidney failure, coma, and can result in death.
Okay, before you go on, I mean, that's neat. What's in Vetsolin? Vetsolin. I know it's insulin, but where are they getting it from?
I'm not sure.
Okay. Does this look like, if you read this, I can't, maybe on that screen, it looks like porcine. Is it? Does that say porcine insulin?
Looks like it.
Okay. That means pig, right? So what they're doing is isolating, and pigs, tissue from pigs is easy to get a hold of, right? So my guess is that they're collecting pancreases from the pigs at a harvesting place, butchering place, and then extracting it out and giving it to the dog in this case. And the one thing you should realize is insulin is a protein hormone, so it doesn't work equally well in all animals. You know, sometimes you can give human insulin to dogs and it works somewhat, or the pig. I mean, it looks like porcine to me, but we could look it up. But it's amazing. Some insulins from some animals wouldn't probably work at all in other animals because of the receptor kind of thing. But I can see where they're getting that, and it's probably not as pure a product as they use in humans because Eli Lilly uses bacteria to make insulin. They don't collect it. Years ago, they used to collect it from pancreases, but now they engineer the bacteria to pump out insulin. And I was at one of those places. I think it was Eli Lilly's, and it's amazing. They have all these large vats that have all these millions, billions, trillions of bacteria, and they're pumping out insulin into the medium. And then I don't know how they extract it, but they do. But it was such a big operation, and everything is turning, everything's heated. And I can't remember if I asked what the electrical bill was, because all these electrical motors are pumping around. And I mean, it was a huge place in many buildings. This place I was at, the monthly electrical bill was $1 million. They were using $1 million worth of electricity to run all this stuff. It was phenomenal. But yeah, it looks like porcine. So it'd be interesting, go back. Yes? Oh, it is porcine.
Yeah.
You guys are on there on the web. Okay, yeah.
As far as manufacturing them, I guess, per se, through the bacteria,
Yeah.
would there be anything different about the structure even slightly, or was it
Well,
exactly the same?
You know what, that's a good question. You're asking if the structure of the recombinant insulin is equal to human insulin. It's got to be close enough that it's working well because they're selling it, but if you looked at every amino acid, maybe not. Because remember, Candace, was that you that were talking about the amino acid sequence someplace and there was a switch of one?
That was mine.
Oh, okay, that was yours, okay. Anyway, so it's close enough that it's working good. I'm not sure if you looked at it, if every amino acid is in the right sequence.
Is like once a day for testing the minimum, or do you do it like every time they eat, like a human?
They
or-
recommend doing it every time they eat,
Okay.
which can be 3 times a day, twice a day.
Mhm.
They recommend feeding 3 times a day just to have that extra
Yeah.
nutrients in there.
Mhm.
But yeah, it's a minimum of once a day.
Okay.
Yeah. Now, can you describe how they check for blood glucose in the cat? You have this cat. What do you do?
Well, we normally have an IV and take blood
Yeah.
from
But
there,
how about at home though?
But at home, you can use a regular glucose monitor that you can get from a doctor or a
Pharmacist or
store.
whatever, yeah.
And you can either take it from the gums or the ear.
But are you still looking for blood?
Yeah.
Yeah.
Yeah, you'll still pinch the nerve and it'll release blood and you'll stick the measure.
Okay.
stick
Okay.
in.
You're still looking for a drop of blood. I was
Yeah.
just curious about that. Okay. Yeah. And so the cat sees you coming and runs under the bed, I'm sure. So yeah, because you imagine doing that twice a day or 3 times a day. It's like cat's gonna freak. Yeah. Other comments, questions? Because this is all good. Yeah, porcine. Now, I'm sure they don't have bacteria making it since it says porcine. So they're collecting pancreases at slaughterhouses and extracting the insulin. That would be a cheaper way, and I bet you it's not as pure as Eli Lilly makes the human insulin, but it's good enough. Interesting. Yeah, it's very interesting, the species, because where was it? The porcine, no, here, it's up there. It's very, very interesting where they got this stuff. Years ago, when medicine started treating diabetics, that's how they extracted it from the pancreas, I think, of pigs. And there's some cross reactivity, but, you know, meaning it works in humans, maybe not equal 1-to-1, but yeah. That'd be a good experience then, I bet, working at that place that you did. Okay, other questions, comments? Here we go.
You said there was something that most people do wrong, right?
Oh, yeah.
Yeah.
Yeah, thank you.
So that's on the last slide.
Okay.
When most people do their at-home treatments, the key is to keep the insulin refrigerated because it is a protein and it can spoil. And then also feeding your dog before giving the insulin. A lot of people won't feed the dog, or the dog won't eat enough food to have enough nutrients in the blood, and so it causes the fluctuation and swings in the sugar.
Because by the time then, that gets to be the half-life of insulin in the dog. How long is it around? It'd be interesting.
Or they insert the needle and they inject the insulin and the dog jerks and some of the insulin doesn't get in.
Gets on the
So
skin.
they draw an estimated amount that they think didn't get into the dog and insert that. That's a big mistake.
Why is that a mistake?
Because you can give the dog too much insulin.
Okay, because
and-
you're estimating and probably overestimate how much didn't
or
go in.
underestimating, and it's
Okay.
better just to let the dog go and have the amount of insulin that they got, and then the next time, because it's within 12 hours, they get insulin again,
Mhm.
and
Okay,
by then it's not a big enough time period.
okay.
So you said there's type 2, type 1, right?
Yes.
With humans, I know type 2 is sometimes curable. Is that possible with dogs? Cats?
They say there's no cure because we don't really know the cause of it.
Well, I think in humans, type 2 is also called adult onset. And I think that is curable with diet and stuff, exercise and whatever, yeah.
Yeah.
When the pancreas doesn't make a lot of insulin, there's not a lot you can do. So that's not really curable. But the type 2 is adult onset. And a lot of people say a lot of that can be cured.
Type 2 is really rare in dogs, but
Okay.
it's more common in cats.
Okay, yeah. See the species differences are amazing. So do you feed and then after they're done eating, inject the insulin?
Yes.
Just like right then?
Just-
They're done with their bowl?
After they've eaten all their food,
Yeah.
you inject the insulin so you pull their skin up between the shoulder blades and inject the needle in between the little pinch that you form.
The tint you have, yeah. So
And-
subcutaneous?
Yes, subcutaneous. And that's just a size reference of the needle down here. It's not really that big.
No. Okay, here's another one, great.
Is there usually any like training session? Because I know humans get shots, they understand that it's to help them, but animals don't understand that. So
At our clinic, we actually focus more on the training of the owner.
Mhm.
And so we will have them practice on their animal with just water. And it's difficult at first if an animal's not used to it, but normally they barely feel it. So if you can get your animal to sit still for a minute, then it's not as bad.
Are there any distraction techniques you can use with a dog? You know, because when I used to, I think weed heifers or something, I always showed my graduate students how to distract the heifer so she wouldn't even know that I was taking a blood sample from the tail. Is there anything that we can do
We
with the dog?
actually use peanut butter. We'll put peanut butter on a door and let them lick it off the door or wall.
On a door?
Yeah. So they'll sit against the wall or door
Okay.
and lick it off, and you can just grab
Yeah,
their
and then,
skin.
so there is a distraction technique, yeah. Because that's always good, because they're working on something else, and then if you're good, you
Yeah.
can, yeah, okay. I thought that might be something. Peanut butter on the wall, that's interesting. Okay, excellent, we've got